Hi, I'm Sheila Reyes from the Philippines, and I'm here in windy Chicago reporting live for Room Now at the ACR Convergence 2025. Hydroxychloroquine during these days of the conference has been again taking the spotlight. And in this video, I will be talking about hydroxychloroquine and blood levels. Now, just to give a brief background, we all know that hydroxychloroquine is a cornerstone in the treatment of SLE. And prior studies on dosing have shown that a dose of more than 5 milligram per kilogram conveys a twofold increased risk of retinal toxicity, whereas a dose of less than 5 milligram per kilogram increases the likelihood of lupus flares 2 to 6 times. So in this video, I will be talking about abstract 1722 entitled Defining Safe Hydroxychloroquine Blood Levels by the group of Dr. Shivani Garg, who that was presented during the plenary session on Tuesday. Now, the primary objective of the study was to validate the upper threshold for therapeutic hydroxychloroquine blood levels or blood level monitoring for routine clinical use. And the second objective of the study was to identify kidney function thresholds with potentially or that are potentially toxic hydroxychloroquine blood levels. Now, pooled data from large SLE cohorts, including the SLIC, Wisconsin, and 3 French studies were analyzed, and hydroxychloroquine levels were either taken from serum or whole blood, and it was taken at baseline. So what do the results show? Among the 1,842 patients who were studied, 4.4 developed toxicity, majority, about 85% of which were retinopathies. And the odds of toxicity was about 1.9-fold higher at blood levels more than 1,150 nanogram per ml, while levels that were less than 750 nanograms per ml was associated with a 1.4-fold higher odds of developing active SLE. Now, they also saw that levels that went beyond 1,150 nanograms per ml were super therapeutic, which means it had no added therapeutic benefit and was potentially toxic, therefore defining the upper threshold of hydroxychloroquine blood levels at 1,150. Now, in terms of kidney function thresholds, they found that patients who were on CKD stage 3 had twice the higher odds of super therapeutic levels of hydroxychloroquine, and this is despite weight-based dosing at less than or equal to 5 milligram per kilogram. How can we apply this to clinical practice, or what are the implications that these study results may have? Well, it reinforces the importance of monitoring blood levels of hydroxychloroquine to guide its optimal use. Now, although the study had strong points, they also had some limitations, and I think validation in larger clinical trials is still warranted. Follow me on X at Rumarampa and tune into Room Now for more updates of the ACR 2025.